According to MSD for Mothers, as we heard this morning, 1 in 10 women in the European Union have no access to maternal health services in the first months of pregnancy. Nearly 1,800 maternal deaths occurred in Europe in 2015. 54% of pregnant women in 9 European countries seen at doctors of the world clinics lacked access to maternal health care and were living in poverty. I would also like to reiterate what MSD for Mothers has stated, and I quote, "Equitable access to high-quality maternal health care should be a fundamental right for all women living in Europe. Unfortunately, the reality is different for millions of women who give birth in the European Union each year. In a region characterized by free movement and differing health systems, the gaps in access to care result in health inequalities, including poor maternal health," unquote. This is the setting to our discussions, a scenario that we cannot possibly ignore if we, as Europeans, truly believe in women's rights as universal, fundamental human rights. We have come together as Women Political Leaders Global Forum to put forward constructive proposals and recommendations to the Commission and the Council of Health Ministers of the European Union. We want our outcomes of this conference in the form of a declaration to be taken up across our Europe. This conference purposely coincides with the informal meeting of the European Union Health Ministers in Malta, with the hope that the issue of maternal health for all women, including migrant and refugee women, is given the proper focus. We believe that it is the time for us to call for practical action to be taken by working in synergy together with all stakeholders to ensure that the maternal health of all women, including migrant and refugee women, is effectively accessible and appropriate to one and all. Commissioner, Minister, our conference is evidence of our shared commitment to ensure that the rights of every woman are respected, to ensure that our international commitment to protect all children is strengthened, and to ensure that we continue to uphold the value of human dignity in all our laws and our policies. Let us also remember our international commitment to the Sustainable Development Goals, and in this particular case, to SDG 3.1, which states that by 2030, we must reduce the global maternal mortality ratio to less than 70 per 100,000 live births. Let me urge you and all members of the Council of Health Ministers of the European Union to make Europe a model of accessible and equitable maternal health care for the world. Let me encourage you to make the health of each mother and her children, whoever they might be, a priority. We must admit that despite the great progress we have made in Europe, we must do much more to address the inequalities and lacuna which exist in our own maternal health systems across our Union. I feel proud that my country upholds an equitable and accessible healthcare system for all Maltese and all those who make Malta their home. Migrants and refugees in my country have full access to a completely free healthcare system as much as the Maltese have. Earlier today, we had the opportunity to share our knowledge with a number of experts in the field who spoke of an impeding long-term strategy which should uphold an accessible and harmonized maternal health system in Europe. Let me urge you, Commissioner and Minister, to move the European Union from words to action by bringing in synergy all stakeholders to commit themselves to practical, innovative and sustainable responses to the often preventable tragedies occurring in real time all around us. On the other hand, I would like to appeal to my colleagues within the Women Political Leaders Global Forum to continue to work together to give due prominence to the experience and to the challenges of all migrant and refugee women and all vulnerable communities. In order to achieve this, we must continue to encourage the respect and dignity towards social and cultural diversity, the participation of civil society, and to endeavour for the empowerment of inclusive and active communities. By doing so, we shall be safeguarding the most treasured ideals and values of our democracies. Let us always remember that material health is not simply a women's issue, but an issue of fundamental human rights. Finally, let me also take a moment to celebrate the work of Silvana as the founder and all the participants of Women Political Leaders Global Forum. Our combined efforts to promote the empowerment of women, to create dialogue among different nations and communities, and to prioritize the well-being of the most vulnerable are a strong example of a deeper commitment we share to build peace and well-being in a united Europe and in an inclusive world. Thank you.
Excellency, Commissioner, and guests and friends. I hear you had a very good meeting this morning, and I'm sure you had a full day, so I had a full day myself as well, so I will keep comments to a minimum. But I think it's a very important initiative, and President, I assure you that we will look very closely at your declaration and we'll make sure that it reaches the other member states and health ministers across the European Union, and I'm sure the Commissioner will also be looking closely, so that Commission and Council will certainly take up this issue over the next few months. Now, for a long time, for I would say the last 20 years or so, the birth rate in Malta has been steadily coming down, or had been steadily coming down. And there was a time after the war when the birth rate in Malta was about 30 to 40,000 live births a year. About 6 or 7 years ago, it came down to about 3,500, yeah? So from 30,000 down to 3,000. But over the last 5 or 6 years, it's been coming up again. And it's come up to close to 5,000 again now. And the reason it's been coming up is that we are having more maternal, more migrant mothers who are giving birth here in Malta. Now, when I say migrant, I don't necessarily mean refugees or people who come here and live in camps. I mean people who come here and make Malta their home. Mostly people from Eastern Europe and people from Italy. And we've seen that in these last few years, between 15 and 20% of live births here in Malta are births to migrant mothers. Now, the worrying thing about this is that if you look at the cesarean section rate, it's higher in migrant mothers than it is, and I'm seeing Maria here, who will be talking to you tomorrow, I think, she's the midwife from the Midwives Union, the president of the Midwives Union, who is very vocal on this. But the cesarean rate in migrant mothers is higher than it is for the local population. And the rate of babies needing intensive care as soon as they are born is again higher in babies from migrant mothers than it is for the local population. And we think the reason for this isn't that mothers and babies are less healthy because they come from migrant families, but it's because there is what is called late booking. Yeah? So when mothers present to their obstetrician at a later stage than they would if they were living here and were local. And part of this is probably a problem that we have with cultural mediation, if you like. So it's a question of migrant or mothers who are not local, not knowing the system enough, not knowing how to contact their doctors or how to contact the health services, and this is something which we need to work on, something which we are conscious of, and that's something that we need to work on. Another thing that we are seeing, and to me is shocking, is the relatively high number of women who come to deliver with female genital mutilation. So close to 3% of our deliveries are to mothers with female genital mutilation. They are not Maltese mothers, they are mothers who are migrants. And I have a special interest in this. I have to tell you this because before I was Minister of Health as a backbencher, I had piloted a private member's bill to ban female genital mutilation. So the bill came into law after the President kindly signed my bill about 3 years ago. So now it is, of course, illegal to perform female genital mutilation in Malta. But even having said that, even as the main mover for this bill, we have to be very careful that we don't give the message that we are clamping down on the partners of women with FGM, because there is a real worry that these mothers will keep away from the health services and give and deliver outside the health services with very bad consequences to their health and to the baby's health. So whilst we have to be very, I believe, strict about on female genital mutilation, which is nothing else than child abuse, I'm sure you all agree, we have to be very careful and very sensitive on how we deal with this. And we are now in the process, because this law has only been in vigor for the last 3 years, of training our health services, our health staff, of training social workers, of training cultural mediators, of training police officers on how to deal with women who have suffered female genital mutilation. On the other hand, as the President rightly pointed out, we have a very good health service, an excellent health service, to which all residents in Malta have full and free access, and our maternal mortality rate is extremely low. We would see not even one maternity a year, maybe one every 3 years. So we're on a very good place where we need to be. But I recognize that we need to reach out further, and there is a language problem sometimes, not just a cultural problem, for our migrant mothers. On the other hand, we are very proud of our system and very proud of our President, I have to say, for the good work that she does. And again, I promise you, Excellency, that the work that you're doing here these next 2 days will reach the European Union ministers, and I'm sure the Commissioner will agree that it is something worth discussing over the next few months. So thank you very much for your efforts, and thank you for your time.
First, I would like to warmly thank our host, Madam President, and the Women in Parliament Global Forum for bringing us together on this important issue. Maternal health is about timely access to quality care for every woman and every infant who needs it. I endorse the 5 pillars you have identified for maternal care: safety and quality, accessibility, efficiency, equity, particularly important for refugee women, and a person-centered approach to care. I am pleased that the conference you held today followed up on discussions on maternal health linked to the Sustainable Development Targets, which were held at the last Gastein Forum. Indeed, the international community has agreed on worldwide maternal health targets to reduce maternal, neonatal, and infant mortality. In the European Union overall, we already achieve and go beyond such targets. However, many challenges remain. Take, for example, the need to ensure that all children are vaccinated. I want to see an end to the preventable death of babies and children from diseases for which vaccines are available. Yet we currently have an outbreak of measles in EU, and sadly, a number of related deaths. This is unacceptable, needless, and tragic, when there is an easy and reliable method of prevention at hand. My goal, my dream is zero cases of measles in the EU, 0 deaths. This must be our shared target. No children should die in Europe from a disease that is preventable through vaccination. And I ask you to help us Can you imagine how many anti-vaccine movements we have on the ground, and how it's difficult to encourage societies to follow scientifically advised methodologies? We also have the challenge of ensuring universal access to health care, reaching out the most vulnerable, the excluded, the migrants and refugees, in particular mothers and small children. In the last 3 years, millions of people left their home countries to seek a safe place to live. Some of these are now living in EU countries, and like all of us, they have health needs. Entire families, men, women, children, elders, are fleeing war zones, seeking safety, looking for a new life, free from fear and persecution. I saw it myself when I went to the island of Lesbos in Greece. I was there when a small boat full of people, babies, small children, women, reached the shore. I witnessed the suffering of women and infants, women being treated in mud tents with no electricity or medical equipment, nothing on the ground. Babies with hypothermia caused by a dangerous sea crossing. Helping refugees, finding solutions to the migration crisis is a key for the European Union, key priority. The European Commission has taken a series of measures to address the situation with a particular regard to health. Last summer, the Commission proposed to revise European Union law to enable refugees to access health care under the same conditions as national citizens of the state where they live, with particular attention to persons with special needs, such as pregnant women. In addition, we propose that all migrants who apply for refugee status are entitled to health care. These proposals are currently being discussed in the Council and the Parliament. As regards maternal care, this is already covered by an international convention, the United Nations Convention of the Right of the Child. All the EU member states ratified the convention, which requires countries to ensure appropriate prenatal and postnatal health care to mothers. The law is one thing, the reality may be quite different. Despite this international obligation, pregnant women within vulnerable groups encounter difficulties in accessing prenatal and postnatal health care, or they are just given emergency care and nothing else. That is unacceptable. Gaining access to health services is not, of course, only a matter of legal rights. Migrants can face practical problems in accessing health services, such as dealing with unfamiliar systems or difficulties in communicating with healthcare staff. Studies show that migrant mothers often experience worse pregnancy outcomes than resident women and can suffer from discrimination and stress. Social integration plays a major role on the well-being of refugee and migrant pregnant women, as well as on the postnatal health. Risks such as low birth weight, preterm delivery, even death at birth, are significantly reduced in countries with strong integration policies. For this reason, the Commission has developed an action plan on integration of third country nationals and worked with the Member States to channel all possible European Union funds for health and also for education and housing. The EU has been working very hard to respond to the health needs of migrants. They have been helping the national authorities in the member states provide health care to migrants using the Asylum, Migration and Integration Fund, which can finance shelter, accommodation, and health care. I remember a call from Malta 2 years ago, and Italy address immediately your needs. Some member states are using the Asylum Fund to finance projects on maternal care. For example, Poland is using such funds to inform migrant and refugee women about pregnancy and childcare. And Spain developed a series of projects to promote maternal and child health in migrant women. In addition, the Commission provided substantial emergency funds to Greece, Italy, and Bulgaria, specifically to help these countries provide healthcare and medicines to migrants. In Greece, for example, the Commission provided over 27 million to the Ministry of Health and over 88 million to the Ministry of Defense to help finance healthcare and medicines at the refugee centers. Through the small EU health program, I have also been supporting NGOs and international organizations on the ground to help migrants access health care. I'm supporting the training of health mediators, most of them refugees themselves, who can support pregnant women in their contacts with health services. I had the opportunity to meet some mediators in Gashvin last year. I am providing a grant to WHO to support clinical guidance to health professionals involved in work with migrants. I am financing the training of health professionals and social workers who provide health care and support to migrants. I am also giving grants to the International Organization for Migration to use patient health records to identify the health needs of migrants in Greece, Italy, Slovenia, and Croatia. Finally, I have recently launched a project on maternal health, Operational Refugee and Migrant Maternal Approach, or RAMA called. This project aims to promote safe motherhood, improve access and delivery of maternal health care for refugee and migrant women, and improve health equality. Dear President, Ministers, honorable members, I believe all people living in the EU should have access to the health care they need, regardless of their nationality, origins, or income. Priority must be given to maternal health, to pregnant women, young mothers, babies, and infants. I will continue to appeal to national governments to do their utmost to meet the health needs of migrants and to pay particular attention to maternal health. The Commission will continue to use all its legal and financial tools to help Member States in this regard. Let us work together to ensure that each migrant mother and each infant receive the best possible health care in Europe. And we can oblige to do it and to encourage all of us to achieve those goals, especially when we are speaking about excellent number 0 deaths. 0 deaths is a really good number.